Welcome to your CEO briefing. So in the last video I did, I talked about the enormous amount of activity that's going on at the state level, right? So think about the legislation and the regulation that's moving. I think we have 19 states right now on a proactive legislative posture. So enormous activity. Now let's talk about what's happening at the national level. And I want to share 4 things that I think we need to watch really closely in 2020 and how they could potentially impact us. And these are 4 big events that are, I think, undoubtedly going to occur. So first thing is, in October of 2019, President Trump signed an executive order. We'll call that the Medicare executive order. And within the executive order, section 5A, there's something that's really interesting to us. And I know this is probably not the first time you've heard this, but I'm going to read it because it's really important. The executive order states, proposing a regulation that would eliminate burdensome regulatory billing activities or requirements, conditions of participation, supervision requirements, benefit definitions, et cetera, et cetera. So clearly this is something that the AANA and other advanced practice nursing organizations are really focused on. And we're spending a lot of time and energy in DC trying to effectuate just that. The other thing that is really interesting, and it's playing itself out in a big way right now already, is the 2020 presidential election. It's going to suck the oxygen out of Washington, D.C., and it sort of already is. I think especially when the impeachment proceedings end here pretty soon, we're going to see a real buildup as things kick off. So, in the Democratic side, think of 2 camps, right? So there's the Bernie Sanders and Elizabeth Warren camp, which are really proposing and advocating for a Medicare for all solution, which is very provocative. And the other camp, we could say there's of the leading Democratic candidates, we can say Joe Biden, who is very much in the let's fix Obamacare, let's make some changes, but let's not completely re-engineer healthcare in this country. And what's going to be really interesting is see how this plays out in the Democratic primary, but more importantly, during the presidential general election, and how their ideas compare to the incumbent President Trump. And this is going to, I think, really influence the way healthcare is designed moving forward in this country. The third thing to really watch closely is the Supreme Court. So this will be the 3rd time since Obamacare was passed that it will be tested at the Supreme Court level. So no earlier than October, probably shortly after October, sometime in the November timeframe, this should make it back to the Supreme Court and evaluating whether or not Obamacare, particularly the individual mandate, is constitutional. And you can think of the consequences of that. So let's say the Supreme Court says, no, it's invalidated. The whole Obamacare framework would be at risk, and it would have significant impact on healthcare in this country. And the 4th thing to watch really closely, and I think that will absolutely impact us, is surprise billing. So I'm sure you've been tracking this in Washington, D.C. The legislation has stalled for now, but we think there's a good chance that in May it could get some legs. And we're working very closely with our congressional allies to take a look at what's going on there and how to position the AANA. Clearly, we feel that patients shouldn't be surprise billed. We want to make sure, however, that CRNAs are protected in any legislation that would address that at the national level. And we're seeing it play out at the state level as well. So there's 4 things. Let's watch those things really closely. As well as some things we don't know are going to happen, but will. We call those the known unknowns. And again, the enormous activity at the state level. So what are we missing? What questions do you have? Let us know. In the comment section here, ask questions, propose new topics. We really want to hear what you have to say. And I hope you have a great week. Thank you.